Hello and welcome to Critical Care MD. My name is Dr. Vikas Koppurapu and I am a physician in pulmonary and critical care medicine. In this video series, I will be providing information on some serious health conditions. Whether you have experienced these conditions or know someone with these conditions, or even if you are here simply out of curiosity, you will find useful health information. Today, we will talk about what happens to patients after CPR. Let's learn about this under following headings. First, we will look at what is CPR. Then we will look at how patients who receive CPR are cared for in the hospital. Then we will look at some complications that can develop. Next, we will talk about the prognosis or outcomes for patients. And finally, we will look at some risk factors and how one can minimize their risk for this serious condition. CPR, which stands for cardiopulmonary resuscitation, is a life-saving intervention that is provided for patients who undergo cardiac arrest. So let's understand what is cardiac arrest. Cardiac arrest is a condition where the heart suddenly and completely stops pumping blood. This is an extremely serious condition because when the heart is not pumping blood, every tissue and organ in the body can suffer from lack of vital nutrients like oxygen. Medically, the term ischemia is used to describe this type of organ damage. It is important to know that cardiac arrest is different from heart attack. Heart attack happens when a clot suddenly blocks a narrowed portion of a blood vessel called coronary artery that supplies blood to the heart muscle. When this happens, the area of the heart muscle supplied by that particular coronary artery suffers from ischemia. Medically, the term myocardial infarction is used to describe this condition. When someone has cardiac arrest, CPR is a life saving intervention that can help with preserving the circulation and minimizing ischemic damage to the vital organs. There are two types of CPR: the basic life support and advanced cardiac life support. Basic life support can be provided by anyone, including people without any medical training. The most important part of basic life support is chest compressions, because delivering shock to heart when indicated is essential to successful CPR. This is also included in basic life support. Mouth to mouth breathing is actually not a vital component of BLS. We will talk a little more about this in later sections. Advanced cardiac life support includes everything in basic life support plus a couple of extra things like ability to place cannula into the vein or sometimes bone of the patient to deliver medications, and ability to provide rescue breaths with 100% oxygen, often by placing breathing tubes into patient's airway. CPR is performed until there is return of spontaneous circulation or ROSC. What this means is that the heart has regained its ability to start pumping the blood. ROSC is confirmed by feeling the pulse. Ideally, the pulsations of carotid artery must be felt. This is a blood vessel located at the level of neck, right next to the windpipe. Now let's talk about how patients with ROSC are cared for in the hospital. Patients who suffer from cardiac arrest are typically very sick and need admission to an intensive care unit. We can talk about the care that these patients receive under three sections. First, we will talk about how the vital organs, particularly the heart and lungs, are stabilized. Next, we will talk about how the damage to the brain can be minimized. And next, we'll talk about diagnosis and treatment of the underlying cause of the cardiac arrest. In the early period after ROSC, instability of the heart and lungs poses the biggest threat to life. Vital signs like the heart rate, blood pressure, oxygen saturation, and respiratory rate are closely monitored in these patients. Low blood pressure or hypotension is a common and serious condition after cardiac arrest. It is usually treated with intravenous fluids like normal saline or lactated Ringer's solution. Some patients need multiple bags of intravenous fluids and may still be hypotensive. For such patients, medications called vasopressors are continuously infused through the veins to stimulate the heart and blood vessels and keep the blood pressure in a normal range. Some patients become dependent on multiple vasopressor medications persistently at high doses, and that is generally a bad sign. For some patients, medications may not be enough and they may need support from devices like pacemakers to constantly stimulate the heart. For some other patients, they need placement of devices directly into the heart or into the major blood vessels to help with blood circulation. Examples include impella and a form of support known as ECMO or extracorporeal membrane oxygenation. These are some highly sophisticated forms of support collectively known as mechanical circulatory support. Now let's move on to the lungs. Maintaining oxygen and carbon dioxide in the optimal range is vital to survival, and these are constantly monitored in patients after cardiac arrest. Several patients after cardiac arrest are in coma and may not be able to efficiently breathe on their own. They are typically placed on breathing machines or ventilators. Depending on the damage to the brain and lungs, they may need anywhere between very minimal support to high level of support. Patients who are dependent on high level of ventilator support persistently generally don't do well. Kidneys are sensitive to ischemia, and when they are damaged, the level of a substance called creatinine goes up in the blood. When they are severely damaged, kidneys may not be able to maintain essential functions like making urine and maintaining electrolytes and acid base balance in the normal range. When the kidneys are unable to maintain these vital functions, the term acute renal failure is used, and such patients are typically started on dialysis, also known as renal replacement therapy. About 10% of patients who suffer from cardiac arrest need dialysis. But the good news is majority of these patients who are started on dialysis ultimately have enough recovery of their kidney function that they can come off of dialysis. Some other important aspects of care for these patients include regularly monitoring for and treating any infections, regularly checking the blood counts like red blood cells and platelets and white blood cells, and providing transfusions when necessary, providing nutrition by placing a feeding tube typically through the nose or mouth directly into the stomach, and regularly monitoring blood sugars and maintaining them in the normal range. The brain is arguably the most important organ affected during cardiac arrest. The brain cells or neurons have a high rate of metabolism and are dependent on a constant blood flow for supply of essential nutrients like the oxygen. The longer the patient is in cardiac arrest or the longer it takes to achieve ROSC, the more severe the brain injury is. Most of patients initially after cardiac arrest are in a state of coma. While there is no medicine that can reverse the damage to brain, there is a form of treatment called active temperature control, previously called as targeted temperature management, that can minimize damage to the brain. Patient's body temperature is maintained at a slightly lower level than the normal temperature for the first 24 to 48 hours. This form of treatment has been shown to improve survival and also to improve neurological function. However, this only applies to patients with severe brain damage or coma following cardiac arrest. It is important to note that most patients have at least some recovery in brain function with time. If a patient is not waking up and interacting immediately after cardiac arrest, it does not mean that they will be that way for the rest of their lives. It is recommended to wait for at least 3 days before doing a proper neurological assessment and estimating prognosis from a neurological standpoint. While the individual organ systems are being supported as appropriate, doctors also do a number of tests to identify the cause of cardiac arrest. These tests usually include imaging like X ray and CT scan, blood tests and urine tests, ECG, and ultrasound or echocardiogram of the heart. Once a cause is identified, prompt treatment is pursued. For example, if the cause of cardiac arrest is myocardial infarction, then a cardiologist is consulted for angiogram and stent placement. Now let's talk about the complications that can happen after cardiac arrest. The most feared complication really is lack of ROSC, which stands for return of spontaneous circulation. This basically means that patient has not survived the cardiac arrest and has died. Some patients who have ROSC may develop recurrent cardiac arrest, especially if the underlying cause is severe or if there has been significant tissue damage from ischemia. In patients who have persistent ROSC, they are still at risk for multiple organs not functioning well. When multiple organs have shut down and patients are on artificial life support, the term multi organ failure is used. In extreme state, such patients may be in a persistent state of coma and dependent on multiple forms of life support like breathing machine or ventilator, persistently dependent on high doses of vasopressors, dialysis, and even mechanical circulatory support. Let's now talk about the survival and outcomes for patients who experience cardiac arrest. The chances of survival depend on several factors. For example, a young person has a much better chance of survival compared to an older patient who has multiple medical conditions. The location of cardiac arrest can have a big impact. Patients who experience cardiac arrest within the hospital have a better chance of survival compared to those who have cardiac arrest outside the hospital. For patients who undergo CPR, the two most important aspects that determine outcomes are time to onset of chest compressions. This is very important. Immediate bystander CPR leads to much higher chances of survival. The other important aspect is time to delivery of shock. Certain types of cardiac rhythms respond to shock treatment, and when delivered in time, that can lead to immediate ROSC. This is why automated defibrillators are made available at several public places like movie theaters and shopping centers. Now let's look at some numbers. Majority of the patients who have cardiac arrest in fact do not survive. Less than half of the patients achieve ROSC. Among patients who have cardiac arrest outside the hospital and achieve ROSC, only 10% are discharged alive from the hospital. This number is slightly better at 19% for patients who have cardiac arrest within the hospital, but still not great. Overall, these numbers show you how serious this condition is. Long term follow up of survivors of cardiac arrest has shown that a fair percentage of these patients experience mental health issues, and several of them have impaired functional ability, including ability to care for themselves. In cases where there has been significant neurologic damage, patients may not be able to perform even basic functions like breathing adequately or feeding themselves. In such cases, they may have to undergo procedures like tracheostomy, where a hole is made in the neck and a breathing tube is placed directly into the windpipe, and something called pig tube or percutaneous gastrostomy tube, where a hole is made in the abdomen and a feeding tube is placed directly into the stomach to maintain nutrition. Such patients need placement in a nursing home for long term. Let's talk about the risk factors and steps you can take to minimize your risk for this serious complication. Lack of exercise, cigarette smoking, and obesity are known risk factors for cardiac arrest. Every person must take care of themselves by doing regular exercise, eating healthy, staying away from smoking, and maintaining their body weight in the optimal range. Coronary artery disease or CAD, where cholesterol builds up inside the blood vessels supplying the heart, is a major risk factor for cardiac arrest. Two chronic conditions that contribute to CAD are high blood pressure or hypertension and diabetes. Patients who have these medical conditions should take utmost care to make sure that these are adequately treated. It is very important to see a doctor regularly and take medications as prescribed for patients who have these conditions. If you are ever in a situation where a person around you has experienced cardiac arrest, knowing certain things can make the difference between the life and death of that person. First step is to be able to recognize cardiac arrest. These patients suddenly lose consciousness and they are not breathing. Most important step to confirm is to feel for pulse. Ideally, the carotid pulse at the level of neck must be felt. If a patient is unconscious, not breathing, and don't have a pulse, they are in cardiac arrest. The very first step to take is to call for help and then immediately start chest compressions until help arrives. Most people are not comfortable with the idea of providing mouth to mouth breaths. Actually, you don't have to do it. In fact, American Heart Association or AHA says hands only CPR can be as effective as conventional CPR, and AHA actually endorses hands only CPR, so you do not have to provide mouth to mouth breathing, at least for adult patients. The best way to be able to provide CPR is to attend a hands-on session where you can practice this life-saving skill on mannequins. Several community centers and fire departments offer this type of classes. There are also some online courses that offer certification and some good quality online videos that can teach you how to provide CPR. I will be providing some links in the description. Please make sure to check out at least the hands-only CPR video from American Heart Association. Let's wrap it up. We talked about what is cardiac arrest, how it is different from heart attack, and how CPR is a life saving intervention for cardiac arrest. We saw how patients who have ROSC are cared for in the hospital. Particularly, we saw how organ systems are supported and how doctors do different tests to identify the cause and treat the cause of cardiac arrest. Then we looked at some complications of cardiac arrest, particularly multi organ failure. Then we talked about the prognosis or outcomes for patients who suffer from cardiac arrest. We looked at some risk factors and steps you can take to minimize your risk for cardiac arrest. And finally, we talked about how knowing the basic skill of CPR can make the difference between life and death of a person who experiences cardiac arrest. That concludes today's discussion. I hope you found this video helpful. If you did, give it a thumbs up and share it with someone who may find this information useful. Also, please subscribe to my channel and I will see you in the next video.